In today's questions, we will explore key preventive screening recommendations for adults, focusing on evidence-based tests that improve health outcomes, and then we'll dive into how to evaluate a hospitalized patient with sudden shortness of breath and signs pointing to a potentially life-threatening condition. These questions highlight critical decision making in prevention and urgent diagnosis. A 50-year-old woman visits the clinic for a routine checkup after recently moving to the area. She reports no significant medical history and says she hasn't seen a doctor in over a decade. She currently smokes about half a pack of cigarettes daily and has done so for approximately 12 years. She has no family history of breast cancer. On examination, her vital signs and physical exam are unremarkable. She asks what preventive health tests she should consider at her age. Which of the following screening tests is most strongly supported by evidence in improving outcomes for her? A. Annual chest radiograph in smokers for lung cancer. B. CA 19-9 for pancreatic cancer. C. Carcinoembryonic antigen level for colon cancer. D. Mammography for breast cancer. E. Pelvic ultrasound for ovarian cancer. The correct option here is D. Mammography for breast cancer, and that is because in the United States, the U.S. Preventive Services Task Force recommends that women aged 40 to 74 who are at average risk for breast cancer get a mammogram every 2 years. Also, the American Cancer Society recommends that women at average risk of breast cancer start annual mammogram screening at age 45. Between the ages of 40 and 44, women have the option to begin annual mammograms if they choose. After age 55, women can transition to biennial, which means every other year screening, or continue with annual screenings. Let's have a look at why the other options are incorrect. Option A is incorrect because in the US, annual lung cancer screening with low-dose CT scans is recommended for high-risk individuals, specifically those aged 50 to 80 who have a 20-pack year smoking history and either currently smoke or quit within the past 15 years. This recommendation comes from the US Preventive Services Task Force and is also supported by the American Cancer Society. Chest x-rays are not the recommended screening method for lung cancer as they are less effective than the low-dose CT scans at detecting early-stage lung cancers. And option B is incorrect because CA 19-9 is useful for monitoring patients with pancreatic cancer and a previously elevated CA 19-9 at the time of diagnosis. It is not recommended as a screening test. And option C is incorrect because carcinoembryonic antigen level is primarily used in the follow-up of patients with colon cancer, but it's not recommended to screen for colon cancer. And option E is incorrect because pelvic ultrasound is not recommended as a screening test for ovarian cancer in average risk women. The on-call physician is asked to evaluate a 65-year-old man with new onset shortness of breath and mild fever. He was admitted 6 days ago for complicated diverticulitis, managed with intravenous antibiotics and bed rest, and has a history of obesity and chronic hypertension. The patient is alert, but reports sharp pleuritic chest pain that worsens with deep inspiration. Vital signs show a temperature of 37.7 degrees Celsius, blood pressure of 140/92, respiratory rate of 25 breaths per minute, and heart rate of 110 beats per minute, and oxygen saturation of 89% on room air. Examination reveals decreased breath sounds at the left lung base, mild swelling of the left calf, and an audible S4. An ECG shows new onset atrial fibrillation, and chest X-ray and arterial blood gas results are pending. Which of the following diagnostic tests is the most appropriate next step? A. Bronchoscopy. B. Computed tomography pulmonary angiography. C. D-dimer test. D. Liver function test. E. Sputum culture and sensitivity. The correct option here would be B. Computed tomography pulmonary angiography. And that is because this patient has high suspicion for pulmonary embolism given his recent immobility, tachycardia, hypoxia, and calf swelling. Pulmonary embolism is an important cause of hypoxia. In a patient who is recently postoperative, it should always be included in the differential diagnosis. This patient has leg edema suggestive of deep vein thrombosis, but a pulmonary embolism can also occur in a patient without clinically evident deep vein thrombosis. And CTPA is the best next diagnostic test. Let's have a look at why the other options are incorrect. Option A is incorrect because bronchoscopy would not be able to help diagnose this patient's likely of pulmonary embolism. And option C is incorrect because in patients with low probability of pulmonary embolism, a D-dimer test is a reasonable initial diagnostic test. However, this patient has a high pretest probability of having a pulmonary embolism, and hence D-dimer test would not be appropriate. Option D is incorrect because there is no evidence that the liver is implicated in this patient, and the liver function test will not contribute to a diagnosis. And option E is incorrect because although pneumonia could present like this, a pulmonary embolism is more likely, and also sputum cultures are time consuming to result and will not assist in a more urgent diagnosis.